Hello and welcome to Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society organization with a mandate to promote good governance, participation, and accountability in Nigeria. I am Adaobi Obiabumo with Chidozie Ogbonnaya.
Welcome to the program.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention for democratic actions against it. We also promote integrity by focusing on rare cases of the display of honesty by public and private individuals in the course of their normal activities. The MacArthur Foundation supports the production of this program.
Today we will be looking at an investigative report exposing how corps members falsify medical documents and feign illness to bypass NYSC protocols. We will also examine other ways corruption is ravaging NYSC scheme.
According to an investigative report by the International Center for Investigative Reporting, ICIR, corps members falsify medical documents to deceive camp officials at the orientation camp. And you will recall that the NYSC mandates every prospective corps member to submit a medical fitness certificate on arrival at camp for the 3 weeks orientation course. The scheme also grants corps members with certain illness the concession to relocate to other states.
Compulsory medical examination became necessary because of the need to appraise the fitness of corps members before subjecting them to rigorous camp activities and mobilizing them for youth service. But unfortunately, ICIR findings show that some corps members obtain medical fitness certificates from online vendors who forged the documents for a token.
This report is a reflection of a national problem, which is the lack of a proper national data bank, porous system, and diminishing integrity of the citizenry. An unfortunate expose from this report is that anyone can obtain a medical fitness certificate on behalf of someone else in major hospitals.
Besides the reported falsification of medical documents by corps members, the NYSC scheme is believed to be challenged by other forms of corruption. A good example is the posting of corps members to states where they will serve, which has been plagued by corruption, according to media reports. And some newspaper reports say Nigerians seeking to influence their posting to Abuja or Lagos could pay as much as 70 to 100,000 naira.
Today's conversation is one that Nigerians have knowledge of, and some of us may have participated in it. So, we would like you to share your experience with us. What do you make of the corruption said to be ravaging the NYSC scheme? What must we do as a country to reduce the falsification of documents and bribery in the scheme?
Be ready to join us through phone and text messages in the course of the conversation. The WhatsApp phone line to send your message is 09022656167, and that is 09022656167. Please indicate your name and your location when sending your message.
The numbers to call will be given shortly.
Let me quickly remind you that an investigation by the International Center for Investigative Reporting revealed that some corps members obtain medical fitness certificates from online vendors who forged documents for a token.
We must also remember that falsification of an official document in Nigeria is criminal, just as it is an act of corruption when graduates pay a token to influence their NYSC posting to the states of their choice.
Originally, NYSC was set up by the government to involve Nigerian graduates in nation building, promotion of national unity and development. But 49 years after the scheme took off, it is challenged by subversion of due process, quackery, bribery, nepotism, and other forms of corruption. We invited the Director General of NYSC, and he is ably represented here by the Director of Corps Welfare and Health Service Department, Omotade Ayolade Folorunsho. Ayodele Folorunsho. Thank you for coming. We also invited the Nigerian Medical Association to join today's discourse. they are not here. Hopefully, they will join us.
But joining us in the studio is an investigative journalist with the International Center for Investigative Reporting, ICIR, Nuruddin Akewushola. You're welcome. We also have the legal advisor and director, Gender Inclusion, Yes Project Initiative. You're welcome to the program.
Thank you.
Okay, we'll start today's conversation first with Nuruddin Akewushola, the reporter with the ICIR. You're welcome once again. Could you share with us an overview of your report and why did the ICIR deem it fit to go into this investigation?
Thank you so much. The investigation is of two layers. Both of them, they are bordering on medical documents. So at ICIR, we found out that the core members they are purchasing fake medical fitness certificates from online vendors. If you go to WhatsApp, Facebook, you will see people on Twitter as well. You see people saying they are selling medical fitness certificates, and core members they are subscribing to it. So we decided to went and undercover, and we tried to obtain these medical fitness certificates, and we observed that these vendors they are forging medical certificates for various hospitals. And in order to establish this, so we tried to go to some hospitals to see how it is obtained, the medical fitness certificate, of course. And we were able to find out that, in fact, the hospitals, they are complicit to this practice, in the sense that when we read them, so we're able to find out that even there are hospitals that they are issuing out medical fitness certificates without the due process. Like an hospital in Cuba, we're able to obtain a medical fitness certificate that someone is fit, and a medical report that someone is having asthma, the same name, so in the same hospital. So that's the essence of the investigation. And let us look at the impact of the fake medical fitness certificate. The rationale behind it is to ensure that before core members, before they are admitted to the camp, they are fit mentally and physically, so before they can be admitted to the orientation camps. But let's take an instance of people who obtain this fake medical fitness certificate. It will be hard for NYSC to assess their fitness. And in the past, this has led to death of core members. Maybe after the thing happened, it will be found out that the medical fitness certificate that the person submitted was actually fake, or the person lied in the medical fitness certificate. So that's the essence of the investigation. So the other part of it is the medical reports, which people use, which core members which they use to seek constitutional relocation. So maybe they will say that they're having asthma, or they're having epilepsy, or any ailment. And we found out that hospitals as well, so they are giving out medical reports. Like if you go to a hospital, they are, we went there and we were able to obtain a medical report for asthma, for epilepsy. So and we found out that
when that particular person does not have that particular illness.
So if you read the investigation, you find out that a medical fitness certificate is obtained at Cuba Cuba Hospital, that a core member is fit. The same hospital issue a medical report that the person is having asthma.
Nuruddin, you went in as an undercover reporter here, journalist here.
Yeah.
And you presented yourself as someone seeking to get this certificate.
Of course.
And no checks, no double checking on why, if truly you are having that ailment.
Not at all.
Okay, you also mentioned that there are vendors on Facebook.
Yes.
How do they operate?
If a keyword search on Facebook, like medical report, medical fitness, you will see many groups on Facebook. NYSC, blah blah, NYSC this, NYSC that, and you see that people are saying, come and buy medical fitness certificate, come and buy fitness certificates, 1,000. It is shown in the investigation. And when you pay the money, in the next few minutes, you see Cuba, Cuba Hospital, National Hospital, Abuja, all these reputable hospitals in Nigeria.
Did you try to buy one?
Yeah, we tried to do that. So it is in the investigation. We went to the hospital. We went to them and we approached them. So we purchased the medical fitness certificate, and we compared it with the ones that core members they are submitting. Almost the same thing. So we were trying to establish that these medical fitness certificates, they are fake. So that's why we went to the hospitals. And after we went to the hospital, that's when we realized that the hospital as well, they are also complicit in this practice. When we went there, we a core member, so just like we want to obtain a medical fitness certificate. They were trying to tell us that the officials meant there that you can get it through a shortcut, or you can get it through a normal process. But they even say that as far as you are core member, you don't even need to do this or go. So just pay the money and it will be sure to you.
Okay, in the course of this investigation, did you interact with some core members to understand why they do some of this?
Yes, it is written in the investigation, and we still have a long list of them. But as a journalist and as a media outfit, there are times that we normally protect the identities of our interviewees so that we don't implicate them. So we were able to interact with people who have used this kind of medical reports, medical certificates in the past, even in the recent batches, and they went away with it.
And what did they say? Because let's leave out their names. What were their own comment on why they did such?
Yeah, actually, there are two reasons that I found out for the issue of medical fitness certificates. They were actually people that they don't want to be, maybe they don't want to be distinguished in the camp, maybe because they're having a certain element or such. So they obtain it through shortcuts. So, and also, there's also the instances of when people maybe the cost that they will pay at the hospitals, because when we went to, because we
okay, we will get back to the cost of getting the fitness
because we actually went there.
Before we look at the legal implications of all of this, we want to sincerely appreciate the representative of the NYSC who is here with us, Omo Fade Ayodele Folorun Show. Thank you and welcome once again.
Thank you very much for having me.
Are you or is the commission aware of this fake fitness certificates by some core members?
I have listened with keen interest to the reports, and if you permit me to also say allegations by my brother, the researcher, the investigative journalist that said they went around to do certain things. And I think this forum is very, very important for the purpose of general enlightenment of publics, and of course, for the entire public listening to us to be conversant with the operations of the NYSC. To start with, the organization NYSC is an enactment of the law and giving specific mandates to carry out. First is the issue of the allegation that medical certificates of fitness and other medical reports have been forged. By the mandate of the NYSC, it's not within the purview of NYSC to move into hospitals to authenticate or audit the nature of reports they give from us at hospitals. But as a responsive and a responsible organization, NYSC has put in a lot of measures in place to sanitize its system and also ensure that due process is followed in the way we do our things. First, if I may enlighten the public, one is the issue of presentation of medical reports rights at the camps. Prospective core members for all I care is part of the mandate of NYSC, and of course part of our routine operations to ensure that whoever is coming to the camp, we call them prospective core members, because as at that point they have not come into the system. And I'm sure some of you here, if not all, are retired core members. You participated in the system. So what we do right at the gate, we have a team there. A team that comprises of NYSC officials, a team that comprises of security agencies in their categories. You have members of the Nigerian Army, you have the NSCDC, you have the DSS, you have pharmacists, you have doctors, you have nurses, you have lab technologists. All these gamut of representations are there. And in the recent time, we are talking of advent of COVID-19. We have COVID-19 Vanguard right at the gate. And what do? They start with screening of every individual coming into camp, because camp is expected to be a safe place for all to live in within a period of 3 weeks. And part of the thing they do is that, one, in their categories, depending on the relevance of the agency represented there, the NDLA are also there to check the issues of importation of drugs into camp. Now, bringing it closer home to the issue at stake is the issue of a medical report. We are not going to stay here and say we are unmindful of the fact that people or prospective corps members go online to procure fake medical reports. Of course, we are aware. In fact, not only that, the issue, the other aspect of procurement of postings online. You know, in Nigeria, you have various human beings and individuals advertising so many businesses, but the fact remains that as responsible citizens that we are dealing with and the graduates of universities and polytechnics in Nigeria, I believe that having attained that level of education, the rightful place to go and conduct or transact your business as it relates to NYSC is very, very clear. If somebody did not go to NYSC to seek for information, of course we have a whole lot of gamut of information on the call-up letter, online, on our portal, and of course on so many social media where we relate with your core members. If such will neglect all these very important media and will go to fake sources to procure whatever services, is quite unfortunate. And we could not be able to extricate that from the malady, general malady that is happening in the country. Of course, NYSC is operating within the matrix of a Nigerian system. And also, we'll be talking about what are the measures we put in place when the fakers or those who procure fake documents brought them to NYSC. I think we're much more interested in enlightening the public in this area.
You can go on with that, sir. Because,
okay.
Because yes, we are talking about, you've acknowledged that yes, some people try to subvert the system, break into it illegally with fake documents. So how do you, or what have you put in place before now or currently to forestall this?
Thank you very much. The issue of fake medical reports, as I said earlier on, there is a particular team that screen all prospective corps members into camp. And you also look at the intention of those who are faking those documents. Number one, the activities at the camp are so regimented, and of course, it can be very, very tasking because there is no dull moment at the camp. Our activities are so tightly packed that it requires somebody who is going to be a participant to be very fit, medically sound in the mind, and of course, be fit in all the sense of it to be able to participate actively in all these activities. To start with, for those who are pregnant, it's a policy of the scheme to exclude them immediately after their registration. The moment we see you visibly pregnant for female corps members, and of course, even when the pregnancy is not visible, the medical report will show we exempt them from camp activities because we don't want to have issues on them.
Okay, let me jump in there. Sorry. You did mention that you have a team of professionals at the entrance of each of the camps to examine all the documents.
Yes.
So how then...
Not only documents, to examine their luggage.
Okay,
yes.
So how then do you make sure that these fitness certificates are genuine?
Thank you very much. Taking it away from the gate screening for those who pass through, who pass through successfully at the gate to go into the camp to register the camp. We also have another team that are responsible for further screening of documents presented at the camp. We have among them, it will interest you to know that since 2016, it was a directive for Mr. President that federal tertiary institutions in each state should take over the running of the camp clinics. And by that text, the implication is that we have a consultant, senior consultant from federal medical centers, from university teaching hospitals, resident with us on camp.
So how then are some of these corps members able to still bring in some of these fake documents?
They will bring, but they cannot use it in NYSC. They are free to bring. They are free to go to any market to procure whatever good that will suit them. But what we are saying here is that they cannot use that in NYSC because of the array of professionals that we have.
Do
For
you
example,
look out for NMA stamps on the certificates?
that's where kudos should be given to NYSC. NYSC was the one that mooted the idea of anyone bringing issuing any certificate of fitness to any prospective core members to ensure that they inscribe their license number and even stamp.
But there's an incident in Bauchi State where a core member died. She is asthmatic, but she brought in a fake document. It was until she fainted and they looked at her medical history, made some calls, and that was when they realized that this particular person is asthmatic.
I must let you know that in camp, there are various degree of ailments that we don't allow them to stay on camp. But let me also let you know that there is no human endeavor that is 100% perfect. You want to see a few. Even when you ask a core member that is sick to go home, they find a way of not wanting to go home. Even when you call their parents,
they still want to remain.
They still want, this girl, this boy has never traveled out of Bauchi before. This is the first time. Please, NYSC should take care of her. NYSC should take care of him. This is the first time he's coming out of the country. But we always insist because one, we don't want to have issues on our hand. We also believe that if a core member, a graduate, who was able to go to school for a period of 4 or 5 years, will also be able to have a medical history at a particular place. We want to try as much as possible to relocate that person either to the parents where they are domiciled or close to where he or she has his medical consultant.
Okay, thank you for that. We'll get back to you. But let's speak with Mary Barrister Ogwiji Mary of Yes Project Initiative. You've been listening keenly to our two guests. So how would you react to this report, and could you walk us through the legal implication of presenting fake medical certificates to constituted authority?
If you ask me personally, I was listening to him when he was speaking. When he mentioned the screening at the gates and everything, I actually have passed through NYSC myself. I know we actually have those persons at the gates, but most times they are not as effective as they ought to be. And
let's say it's been long.
Yes, like
you said.
Maybe they have
so
improved.
maybe they've improved.
Except that, because I served 2018. It's not so long.
Okay.
Please go ahead.
Okay. So, and aside that, there's an aspect I feel they may not be able to track. Like, for example, especially those certificates that are given from general hospitals. Because general hospitals, they actually have their forms and everything. So no matter how, no matter how effective a doctor is, you cannot say you see a document and it's fake. Like, because one, it's coming from a reliable source. Maybe except the ones that they get online. It may not match with the original documents that they give in the general hospitals. That's the only one you can actually fault. And from what he said, if we have to go by his allegations, as he put it, if we have to go by it, and because most of the certificates that are given are actually given by hospital staff, maybe even the people that are licensed to give those documents. So definitely, those documents are authentic that are being brought before the NYSC. So it will be very difficult for one to decipher the fact that this particular document is it's fake. So I would just like to just add that.
It's just that the process is compromised.
Yes, just the process that is compromised, but else the authenticity of the document is actually there. So I would just want to just like in my own way advise the NYSC that, like, when I was in secondary school, they actually gave us forms like that to do medical certifications and the rest. And most times when you go to a hospital and tell them you want to do medical certifications, some of them don't even go as much as doing asthmatic test or the rest. They will just pick your blood sample, do HIV test, maybe know your blood group, your genotype, and maybe if you have typhoid and malaria. They have very few things that they use, and immediately they just notice that you are okay. They just certify you as fit. So I feel like the NYSC should come out with guidelines, maybe asthma, like different kinds of tests, so that definitely it will take somebody that is really enlightened to fill that kind of form for you adequately. I think it will reduce and curb this getting certificates online and everything. And like I was reading a report, and I think that report, many hospitals were complaining that NYSC do not go to the hospitals to confirm the authenticity of the reports that are given. So I feel, okay, like from what he said, it's not actually their duty to confirm that, but I feel maybe if the government, or they can create a sector or a setup to help in that area, it would be good. Or maybe they can just handpick some few persons and do due diligence with them, and maybe after those due diligence, make sure that they faced as in the wrath of the law, like adequately. And I think
now that you mentioned
help,
what are the implications, legal implications of presenting a fake document?
Okay, according to section 467 of the Constitution, generally it's forgery. Generally, it's 3 years imprisonment from the Constitution, 1999 Constitution of the Federal Republic of Nigeria. That's 3 years for legislations that do not cover for the penalties. And for those people that actually go as far as duplicating government seals, they even have like those ones, their punishments are up to life imprisonment. You can get a life sentence for duplicating like a government seal or a stamp in order to make a document authentic. Then under the penal code, we have under section 362 and then section 364, somebody can be given up to 14 years imprisonment for presenting forged documents. So and that's the penal code is operational in the north, and Abuja is covered under that jurisdiction. And we also have the criminal code, which is covered by the southern part of Nigeria, and I think that's under section 463. It also covers for forgery, and the penalties you can get are up to 3 years. I think that's the maximum that is stated there. But under the penal code, there's an option of fine. They can either give you up to like 14 years with an option of fine, or you can have both. Do
you think what we are operating on, they are stringent enough to deter people from even attempting forgery?
I think they are stringent enough to actually deter people. That's if they actually take those people to be prosecuted. I think our major problem in Nigeria is the system. We have laws in Nigeria that cover almost everything, but those laws are hardly implemented. Like the courts, we say the court is not a Father Christmas. The court will not go around fishing out for criminals to take to the court to the courts just to make sure that they fit their penalties.
So you have to establish your case.
Yes, you have to establish. Somebody has to bring. Somebody has to prosecute for the law to pick it up from there. So I think one of the questions we'll ask our NYSC representatives, what have they been doing so far concerning the persons that they have picked? Although under the NYSC bylaws, I think item 16 is written there that anybody who is who forges like a medical certificate or any certificate will be handed over to the police for due prosecution. So now the question is, with the level at which people are complaining about fake documents, as in with the rate at which, with the number rising each day,
what are they doing, right?
Yes, what are they doing? Are we actually having this as a number? Are they actually reporting these cases, or is it that some people come and just beg and say, sir, allow my daughter go, and they let them? Because if you keep letting people go, let
me jump in here, because Mr. Omofade already set the stage by telling us they are aware. So as we go on, before he will respond to that and tell us what they are doing, to those, at least they must have caught somebody with fake certificate.
Because he actually mentioned that earlier too. But
we must quickly remind our listener out there that you can follow us on our social media platforms at Official Prime Work.
So the program is interactive. The WhatsApp phone line to send your message to is 0902 265 6167. That is 0902 265 6167. This number is for messages only. How would you react to the conversation? We would like you to share your experience with us. What do you make of the corruption ravaging the NYSC scheme? And what must we do as a country to reduce the falsification of documents and bribery in the scheme?
We'll be glad to read your messages. You can also send message to our phone line 09022656167, and we'll read those messages.
Okay, while we are waiting for the calls, let's get back to Omofade Ayodele Folorun Show. Okay, there are allegations of corruption with respect to posting of core members. Could you throw more light on that?
The allegation,
what are the other challenges facing the
allegation, as it were, as I listened to my
I want to pick up from there.
Nuruddin.
Okay.
Before I go on to answer that, my dear sister, the legal expert, I'm very much happy she's conversant with the act and the bylaws of the NYSC. Part of the measures we put in place that will make it almost impossible or difficult for us to accept fake medical reports is the issue of the online registration of core members.
Okay.
There is a proviso in that platform that asks for your status of health. And these are information that you volunteer without any interference at the point of registration when you are here to even come in contact with the NYSC. That is the first contact with the NYSC. When you put in there, your health status is good, is excellent, is poor. It is not just there for decoration. They are meant to take critical decisions that pertains to that core member. So when you are coming for issue of relocation, for issue of posting, having put there that you claim to be medically fit, you claim that your status is very, very good, it becomes very difficult to present another paper that will contradict the position you have obtained. I mean, you have volunteered. But Nigeria is such a wonderful country where anybody can come and want to circumvent the system. You cannot rule out that one out, and it happens. But my take is that if we have been able to identify where the racket takes place, I think we should take the message to such establishments who have the mandate. For example, I expect that such information should be given to Federal Ministry of Health to look at, because they are the ones supervising hospitals, to look at how easy it is. Why is it so easy to procure medical certificate with just a fee? When somebody will pay a fee and without donating samples for him or her to be tested.
What is the synergy like between NYSC
we
and...
are collaborating with virtually all agencies of government that are relevant. And Federal Ministry of Health is a particular collaborating agency that we deal with. When we have issues like this, just like my sister said, the ones that are caught, we hand them over to the police for prosecution. The ones that are within the ambit of NYSC administration, we have our bylaws that guide us. Forging of documents, we know it's a criminal offense. We hand them to police for proper investigation and prosecution.
Okay.
Therefore, Ministry of Health,
let me jump in there.
We have had instances where we reported.
Please, let's take this.
Okay, please go ahead.
Yeah, I think our major problem in Nigeria is that the fundamental problem is on the top. Because the way the representative from NYSC is talking, like, there's no problem from the top. The same people at the top are giving posting to their family and friends. And what do you expect people coming from the other side, from Nigeria? It's the path that has been set already. When people don't even make, just a note or post this person here. That's why people now have to go through that way to now say, okay, let me look from how we're all Nigerians, we know what the situation is. Now somebody in Lagos doesn't want to serve in maybe Borno or Jigawa because of funds and everything,
Okay, let me ask you a question if you're still there. Is it the person at the top that would ask you, an individual, to fake your medical report knowing the implications?
Okay. Do you know something? The same way you said, which top person has been prosecuted for those frauds in Nigeria? No, that is the thing we need to talk about. Not graduate. You understand? If you want to change this country, you have to start from the top.
All right.
A graduate, because you want to give 3 years improvement.
Okay, could you wrap up in 30 seconds?
If NYSC staff has been held responsible for anything as, show an example. But they will do everything secretly, whatever. Those are situations in the...
Okay, thank you for your contribution. We want to give other people the opportunity to make their own contributions.
I think his point is made, but
yes.
we cannot come out of this smelling like a rose as citizens, because you that forge document or approach somebody to help you forge document, you are equally guilty of something.
If I may even add, in the operations of NYSC relocation, I talk about the intention of those who are forging these documents. Yeah. What are their intention? One, to gain a relocation unfavorably. Relocation in NYSC is free of charge. Approach the authority with your problem. We put that proviso there to ask for the status of health of prospective co-members and co-members. When you approach the authority, I am sick. Of course, we have medical personnel who will examine that person. Is it a type of sickness that warrants relocation?
So what are the types of sicknesses now that warrant relocation?
We have terminal diseases. Somebody who is a sickler who have a medical history and has a consultant or a medical personnel who is conversant with that person. But we want to relocate that person close to the parents for parental care and also for proper medical attention.
But in your with your experience and having stayed long in NYSC,
yes,
how many people can we say have been prosecuted?
My dear learned sister said that much. The problem of Nigeria is not the absence of laws, but implementation of such laws. I cannot say here and say this is the number of persons that have been prosecuted now, but I'm aware that people have been caught in the past and have been handed over to law enforcement agents who have the responsibility of prosecuting them.
And you are still handing over.
There are some that we are still handling. And as the director in charge of core welfare and health services, the issue of disciplining of core members falls within the purview of my table. There are some that I said are within the purview of administration of NYSC that we handle. We have our bylaws in place that also prescribe punishment for such offenses, and that we are doing on daily basis.
It takes a lot of courage to say if you are part of the forgery scheme.
You may not tell us your real name, but you could just tell us why you did what you did. We really want to understand. Nuruddin, what do you think the NYSC should do to help prevent some of all this?
Like the director has rightly said, the problem with Nigeria is not about the lack of rules, but the implementation. Like the investigation that we did at ICR, one of the things that we were able to find out is we observed that before there was a synergy between NYSC and Ministry of Health on ensuring that NMA stamp is attached to medical certificates, at least to ascertain the authenticity. So, but we find out that this is not even happening again. Like there are many medical certificates without NMA stamp, and it's being accepted at the camps. So, I just want to advise that the NYSC they intensify effort in devising a lot of ways to ensure that the medical certificates being presented by core members are authentic, at least to prevent some consequences attached to it, such as the issue of death of core members slumping at NYSC camps and others. Thank you.
Okay, let's take this call. Hello, your name and where you're calling us from?
I'm calling from Kaduna State.
Let's hear you.
Please, I want to ask concerning the age limit of enrolling for the NYSC.
Okay.
Hello.
Okay.
Yes, we got that. Thank you so much for your contribution. Let's take this other call. Hello.
My name is Daniel. I'm calling you from Kubo.
Let's hear you, Daniel.
Thank all the participants and Mr. Pretty and the NYSC for this, as well as those that did the research and the investigation. You see, the problem, just like the Vice has said, the problem is all encompassing. How can people be forging medical reports in order to, what if, like he said, about somebody died,
that means she didn't reveal her true status. Now, whose fault is that? She killed herself. So the problem is a mental failure, because people they are taking action or doing things that they shouldn't do. So I just like the fact that they must be prosecuted, and somebody has to be responsible. Like the NYSC is not addressing the issue the way I want. He's trying to say that they are not aware of or that people do not, not that people do not fall, but they don't get through. It's not true.
He didn't say so.
He acknowledged that they are aware of some of these activities.
So how many people have they prosecuted?
Okay, how many people have they prosecuted?
Give us numbers. Give us something.
Okay, thank you. He will respond to that. The youth are the ones fingered in this report and allegations.
They are the ones forging
documents.
Yes.
So what must we do as a nation to ensure that we discourage acts of corruption and promote integrity amongst our youth and the nation at large?
Okay. If you ask me, this will I say, it's not just an NYSC problem. The problem has to do with, one, the breakdown of, will I say, law and order generally in the country.
Please let me take this call. Hello? In your name and where you're calling us from?
It's Patrick. Yes.
Let's hear you, Patrick.
Yes, I don't think, like the other person said, I think NYSC needs to be thorough in prosecuting those who are victims who have been caught to them. And again, it's a social problem. An earlier caller was trying to explain that where things are not working from the top, how it's much more difficult. You know, like it was trying to, nobody justifies crime, so to say. But the Nigerian system is so corrupt that an average poor person cannot really get anything done without some of those manipulations.
But what must we continue on this path?
We cannot, but the problem must begin from the top. That is why I don't believe in this, what do you call it, this ABC thing of change begin with you. No.
So you think?
No, change actually also should begin with you.
It doesn't begin with me, begin with somebody who is put in charge to implement change.
If all of us
So
are
who
waiting,
is that somebody? That person would also say change begins with me. So we all have.
Why leadership? Why we have leadership?
Okay, so you believe in bottom down, top bottom approach.
Not in the case of trying to enforce order and discipline in society. Somebody is responsible for this. And if we check from the top, our people always look up to those who are leaders. It's just like saying the society is that the youth are learning from the elders. We have been talking about the issue of bullying and diverting.
Okay.
To bully because they have been victim, they have learned from home.
All right.
Okay.
Thank you for your contribution because of our time. Thank you. Okay, now he also mentioned that youths learn from the elderly ones. So could you
just wrap up
you?
on your thoughts?
Okay. Like generally, like I was saying, the problem has to start with the breakdown of law and order. What are the reasons why people are actually going to falsify these results? One is because nobody wants to go to an area where there are security threats. So if we as a country, especially the law enforcement agencies, make sure that, okay, there's security in place, and let's say every state, because now we have some juicy states in quotes, Lagos, Abuja, Port Harcourt, and some other like areas that people actually see as elite areas. Nobody wants to go to like the other areas that are not as in termed the elite or the urban areas. Everybody wants to go to a place where they feel after like their NYSC they have opportunities.
So what should we do to the youth? What should we tell the youth to discourage them from this, as well as promote integrity?
I think we should just make sure that we preach a lot of patriotic spirit. That's one. And if you ask me generally, I think it's even a personal damage, because if you falsify your results and tomorrow you actually have like a problem, it's going to be used against you. Imagine you put in that you are AA, meanwhile you are AS, or maybe you are SS. Just imagine that there was an emergency situation now and they have to use your medical certificates, the history that you have put down there to treat you. Unfortunately, you may be lost before they can start finding out the actual, as in, cause or reason for your challenge. So we should first of all think about ourselves and the damage that this whole thing will happen to. We should self-love and love for the country.
But Mary, I will have to jump in here because of our time, so that we'll get to the man from the NYSC.
In 1 minute, someone asked about the age limit for NYSC.
Age limit for NYSC is 30 and below.
30 and below.
As at the day of graduation.
Other callers also talked about prosecution.
Well, we'll do more in that area. But let me quickly say here that the issue of integrity and our value system, we have to take a serious audit about that. You see,
on the side of the citizens.
On the side of the citizens, you have instances whereby a parent will procure JAMB result, procure WAEC result for their wards. What do we make of that? Such person will end up being a fake doctor, being a fake engineer, and all this stuff. So let us re-examine our value system in the country. And to the youths, the fact that leaders, they said, have failed does not mean that youth cannot also be on the side of good integrity.
Okay, thank you. The phone lines are still buzzing, but you can send a text message to us on 0902-265-6167. We really must go because of our time.
Yes, we have to go. But I want quickly to tell you to tell the NYSC to look at the stamping of certificates. It's been a robust discussion here, but we have to go. Please visit the news page of our website, primognews.org, and that is primognews.org for all the details of our reports and interviews. Visit our website, www.primog.org, to get all the information about Primog.
And you can watch our videos on Primog TV, our YouTube channel. Please subscribe to get reminders when we have a new post. We sincerely appreciate our guest, the investigative journalist with the International Center for Investigative Reporting, ICIR, Nuruddin Akewushola. Thank you for being here. We also appreciate the legal advisor and director, Gender Inclusion, Yes Project Initiative, Barrister Owiji Mary. Thank you for being here. And also to Omofade Ayodele Folorunshaw, who is the Director, Core Welfare and Health Services Department at the NYSC Headquarters, Abuja. Thank you for being here.
Thank you very much.
Public Conscience has the support of the John D. and Catherine T. MacArthur Foundation, committed to building a more just, verdant and peaceful world. Get more information about the foundation on its website, macfound.org.
Join us again here next week for another episode of Public Conscience, and remember to follow us on Facebook, Twitter and Instagram at Official Primog. I am Chidozie Obunnaya.
And remember that birth registration and birth certificates are both free if your child is under 18. Help stop the corruption in the birth registration and do not pay for birth certificates. And also remember that you can give us information or hints about Corrupt Act through our phone 0902-265-6167 or info@primog.org. I am Adaobi Obiabumo. Stay safe.